Hi everyone and welcome back to my channel. If you're new here, my name is Aman Praveen and I am a second year medical college student in SMMC India. This will be my first pharmacology video and I'll be teaching you about biotransformation, and let's get started. The resources I used are the Katz and Pharmacology textbook, the previous year university question papers, the Kaplan lecture notes, and the eGurukul app. I have left a link in the description for the notes which I prepared on biotransformation. Go check it out. The important university questions on biotransformation are biotransformation itself. It's an essay question, which is otherwise framed as drug metabolism. And then the phase 2 biotransformation reactions are a short notes. So what is biotransformation? As you know, it is drug metabolism. You see, drugs undergo absorption, metabolism, and excretion. And metabolism has a huge part in it because certain drugs only act upon human body after they get converted into a metabolite. These drugs which we ingest are usually lipid soluble, which is easy to absorb. But is it easy to excrete? No, it's not. Water soluble substances are easier to excrete. Therefore, metabolism converts these drugs, these lipid soluble drugs, into water soluble, which are easier to excrete. Where does these metabolism occur in our body? The main place where metabolism occurs is the liver. There's the intestine, the placenta, the GIT, the lungs, skin, kidney, brains. Biotransformation takes place under two phases, the phase 1 and phase 2. The phase 1 is a non-synthetic reaction and the phase 2 is known as a synthetic reaction. Why is it called synthetic reaction? Is because a new group is added to the drug, otherwise called as conjugation. So in phase 1, there are certain reactions which occur. Those are 5 in number. The 5 reactions are oxidation, reduction, hydrolysis, cyclization, and decyclization. In oxidation, there are 3 types: hydroxylation, in which there's the aliphatic hydroxylation and aromatic hydroxylation, and then there's dealkylization, and then there's deamination. In phase 2 reactions, there's a simple mnemonic to remember it, that is 3G-SAM. 3G-SAM is explained as, the first one is glucuronide conjugation, which is the most commonest form of reaction in phase 2 in metabolism. And these have glucuronidation occurs in various drugs, and one of the important ones are chloramphenicol. You see, chloramphenicol can be given to all adults because their liver has been matured up. Whereas if you give chloramphenicol to any baby, see, the baby's liver isn't mature enough, so it undergoes hepatic toxicity, and this causes a syndrome known as gray baby syndrome. And then there's glycine conjugation, which metabolizes aspirin. Then there's glutathione conjugation, which metabolizes paracetamol. And there's sulfate conjugation, metabolizes paracetamol and methyl dopa. And then there's acetylation. Acetylation, there are 2 reactions in it. First one is the slow acetylation, and then there's the fast acetylation. It undergoes pharmacokinetic variations, and then the drugs which it metabolizes is the dapsone. In acetylation, one of the main drugs which gets metabolized is the ship drugs. You see, the ship drugs, which are sulfonamide, hydrolysine, isoniazid, procyanamide. These 4 drugs are known to cause drug-induced lupus, which is an important MCQ question. There is methylation. In methylation, it converts one form of a drug to another. For example, the noradrenaline is converted to adrenaline, and then the histamine is converted to methylhistamine. You see, these metabolic reactions, it requires enzymes, right? And these enzymes can be classified into microsomal enzymes and non-microsomal enzymes. You see, the microsomal enzymes are located in the smooth endoplasmic reticulum, whereas the non-microsomal are present in the cytoplasm and mitochondria. The main enzyme for microsomal enzymatic reactions is the cytochrome P450 enzyme, and this is the major enzyme which conducts metabolism, whereas in non-microsomal it is the esterases and amidases. These microsomals can be inducible. They can be induced, or they can be depleted, whereas the non-microsomal are non-induced. The examples of microsomal enzymes, all the phase 1 reactions and the glucuronide conjugation in phase 2 reaction. The examples of non-microsomal enzymes are all the phase 2 reactions except glucuronidation. You see, microsomal enzymes can be inducible and inducted, or it can be inhibited. And when the enzyme is induced, what actually happens is the drug comes and joins with the body and joins with the cell, and it promotes protein synthesis, and this protein synthesis thereby increases the enzymatic activity. As we all know, all enzymes are proteins, and when there's more protein synthesis, there's in turn a lot of enzymes, and when there's a lot of enzyme activity, the drug metabolism also increases, thereby it quickly metabolizes and eliminates all the drug, and thereby decreases the duration of the drug action. Whereas in enzyme inhibition, what happens is the drug comes in contact with the cell and it decreases protein synthesis, and thereby it decreases the enzymatic activity, and which in turn slows down the drug metabolism. And since the drug isn't metabolized as quickly as enough, it stays back in the body, and it increases the duration of action of the drug. Now, drugs undergo metabolism, and what is its fate? The first one is an active drug is ingested, and then what happens is it turns inactive. That's the most commonest one. You ingest something which is required for you, it gets metabolized, it deactivates. That's all. The other one is this active drug becomes into a toxic metabolite. Certain drugs need to be activated at certain places only. Therefore, what happens is uh, a drug is given, and then it gets absorbed, it goes and reaches its site, and over there it gets metabolized and converts into an active metabolite, which in turn does the activity. This in turn has a longer duration of action, because the drug also works and the metabolite also works, so there's a lot of duration in its action. And then there's the prodrugs. Prodrugs are the drugs which we take in, it reaches a site, and then over there it becomes activated and it works. For example, we need certain drugs to cross the blood brain barrier, such as we need to some in some certain cases we would require to give dopamine to the brain, and dopamine doesn't pass through the BBB. Therefore, we give levodopa, which passes the blood brain barrier, and in the brain it gets converted into dopamine. I hope you found this video useful, and if you like this video, click the like button, and if you want to show support to me, click the subscribe button and share it with your friends. And always be awesome.